Hi, everyone. This is Nurse Anna from nursestudy.net. We are continuing our cardiovascular disorder series. This is going to be 25 questions for pulmonary embolisms, and then we will be moving on to another one in a couple days. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 55-year-old patient with a history of deep vein thrombosis, DVT, is admitted with sudden onset of shortness of breath, chest pain, and tachycardia. The nurse suspects a pulmonary embolism, PE. What is the nurse's priority action? A. Administer oxygen at 2 liters per minute by a nasal cannula. B. Prepare the patient for a spiral CT scan. C. Notify the healthcare provider immediately. D. Initiate continuous cardiac monitoring. Answer. C. Notify the healthcare provider immediately. Rationale: the nurse's priority action is to notify the healthcare provider because a PE is a medical emergency that requires immediate intervention. Oxygen can be administered and diagnostic tests prepared for after the healthcare provider is informed and orders are received. Question 2. A patient on anticoagulant therapy for a confirmed pulmonary embolism reports new onset hemoptysis. What is the most appropriate nursing action? A. Increase the anticoagulant dosage as prescribed. B. Reassure the patient that this is a normal side effect. C. Hold the next dose of anticoagulant and notify the healthcare provider. D. Place the patient in a Trendelenburg position. Answer. C. Hold the next dose of anticoagulant and notify the healthcare provider. Rationale: hemoptysis can indicate a potential complication such as bleeding due to anticoagulant therapy. The nurse should hold the medication and notify the healthcare provider to reassess the patient's condition and treatment plan. Question 3. A patient with a suspected pulmonary embolism is receiving continuous heparin infusion. The nurse notices that the patient has a significantly increased APTT. What is the appropriate action? A. Increase the rate of the heparin infusion. B. Administer protamine sulfate as prescribed. C. Stop the heparin infusion and restart at a lower rate. D. Continue monitoring without making any changes. Answer. B. Administer protamine sulfate as prescribed. Rationale: protamine sulfate is the antidote for heparin overdose. An increased APTT indicates excessive anticoagulation, which can lead to bleeding complications. The nurse should administer the antidote as ordered. Question 4. A nurse is caring for a patient diagnosed with a massive pulmonary embolism. Which of the following interventions should the nurse anticipate first? A. Initiate intravenous thrombolytic therapy. B. Prepare the patient for emergency embolectomy. C. Begin IV fluids to maintain blood pressure. D. Place the patient in a high Fowler's position. Answer. A. Initiate intravenous thrombolytic therapy. Rationale: thrombolytic therapy is often the first line of treatment for a massive PE to rapidly dissolve the clot and restore pulmonary circulation. Other interventions may follow based on the patient's response. Question 5. A patient with a recent diagnosis of pulmonary embolism is prescribed warfarin. Which laboratory test should the nurse monitor to determine the effectiveness of the treatment? A. Partial thromboplastin time, PTT. B. International Normalized Ratio, INR. C. D-dimer levels. D. Complete blood count, CBC. Answer. B. International Normalized Ratio, INR. Rationale: INR is used to monitor the therapeutic effects of warfarin therapy. The target INR range for a patient on warfarin is typically 2.0 to 3.0, depending on the clinical scenario. Question 6. A nurse is reviewing discharge instructions with a patient who has been treated for a pulmonary embolism. Which statement indicates a need for further teaching? A. I will take my warfarin at the same time every day. B. I can stop taking my medication once I feel better. C. I will schedule regular blood tests to check my INR. D. I should avoid foods high in vitamin K. Answer: B. I can stop taking my medication once I feel better. Rationale: patients should not stop taking anticoagulants without consulting their healthcare provider, even if they feel better. This misunderstanding could lead to a recurrence of thromboembolic events. Question 7. A patient develops sudden dyspnea and chest pain while receiving IV heparin for a confirmed pulmonary embolism. What is the nurse's immediate action? A. Increase the oxygen flow rate. B. Elevate the head of the bed. C. Stop the heparin infusion and assess for signs of hemorrhage. D. Call a rapid response team. Answer: D. Call a rapid response team. Rationale: the sudden onset of dyspnea and chest pain in a patient receiving heparin therapy could indicate a worsening of the PE or a complication such as a hemorrhage. Immediate assessment and intervention by a rapid response team are necessary. Question 8. A patient receiving thrombolytic therapy for a pulmonary embolism is at risk for bleeding. Which of the following assessments should the nurse prioritize? A. Monitoring for signs of internal bleeding, such as decreased hemoglobin and hematocrit. B. Assessing for peripheral edema. C. Monitoring for hyperkalemia. D. Assessing for hypocalcemia. Answer: A. Monitoring for signs of internal bleeding, such as decreased hemoglobin and hematocrit. Rationale: thrombolytic therapy increases the risk of bleeding. Hemoglobin and hematocrit levels should be monitored to detect internal bleeding, which can be life-threatening if not promptly addressed. Question 9. During the administration of enoxaparin to a patient with pulmonary embolism, the nurse notes bruising at the injection site. What is the best nursing intervention? A. Apply pressure to the injection site for 1 to 2 minutes. B. Rotate injection sites and avoid areas of bruising. C. Hold the next dose of enoxaparin. D. Administer the next dose intravenously instead of subcutaneously. Answer: B. Rotate injection sites and avoid areas of bruising. Rationale: enoxaparin can cause localized bruising due to its anticoagulant effects. Rotating sites helps minimize this effect. Holding the dose is not necessary unless there is significant or unexplained bruising. Question 10. A nurse is preparing to administer a prescribed dose of alteplase to a patient with a confirmed massive pulmonary embolism. Which of the following is the most critical assessment prior to administration? A. Current blood pressure and heart rate. B. History of recent surgery or trauma. C. Recent intake of anticoagulant medication. D. Presence of deep vein thrombosis. Answer: B. History of recent surgery or trauma. Rationale: thrombolytic agents like alteplase are contraindicated in patients who have had recent surgery or trauma due to the high risk of severe bleeding. This history must be evaluated before administration. Question 11. A patient on warfarin therapy for pulmonary embolism reports frequent headaches and occasional nosebleeds. What should the nurse do first? A. Advise the patient to take aspirin for the headaches. B. Instruct the patient to skip the next dose of warfarin. C. Check the patient's INR and contact the healthcare provider. D. Encourage the patient to drink more fluids. Answer: C. Check the patient's INR and contact the healthcare provider. Rationale: frequent headaches and nosebleeds may indicate over-anticoagulation. The nurse should check the INR to assess the level of anticoagulation and notify the healthcare provider for further instructions. Question 12. A patient with a history of atrial fibrillation is admitted with a suspected pulmonary embolism. The nurse anticipates the healthcare provider will order which of the following medications first? A. Warfarin. B. Heparin. C. Aspirin. D. Enoxaparin. Answer: B. Heparin. Rationale: heparin is typically the first-line anticoagulant used for the initial treatment of pulmonary embolism due to its rapid onset of action. Warfarin is usually initiated later for long-term anticoagulation. Question 13. A nurse is teaching a patient who has been discharged on rivaroxaban for a pulmonary embolism. Which of the following statements should be included in the teaching? A. You will need to have your INR checked regularly. B. Avoid taking over-the-counter NSAIDs. C. You can take this medication at any time of the day. D. Increase your intake of green leafy vegetables. Answer: B. Avoid taking over-the-counter NSAIDs. Rationale: NSAIDs can increase the risk of bleeding when taken with anticoagulants like rivaroxaban. Patients should avoid these medications unless directed otherwise by their healthcare provider. Question 14. A patient receiving IV heparin for a pulmonary embolism suddenly becomes hypotensive and tachycardic. What should be the nurse's immediate action? A. Increase the rate of the heparin infusion. B. Administer IV fluids as ordered. C. Assess for signs of bleeding and stop the heparin infusion. D. Place the patient in a supine position. Answer: C. Assess for signs of bleeding and stop the heparin infusion. Rationale: hypotension and tachycardia could indicate internal bleeding, especially in a patient receiving heparin. The nurse should stop the heparin infusion immediately and assess for signs of bleeding. Question 15. A patient with a pulmonary embolism is being considered for placement of an inferior vena cava (IVC) filter. The nurse understands that the primary purpose of this device is to A. Dissolve existing blood clots. B. Prevent future emboli from reaching the lungs. C. Improve cardiac output. D. Facilitate the administration of thrombolytics. Answer: B. Prevent future emboli from reaching the lungs. Rationale: the IVC filter is designed to trap emboli before they reach the pulmonary circulation, thus preventing recurrent pulmonary embolism. It does not dissolve clots or directly improve cardiac output. Question 16. A nurse is providing discharge instructions to a patient who was treated for a pulmonary embolism. Which lifestyle modification should the nurse emphasize to prevent recurrence? A. Limit your fluid intake to avoid blood clots. B. Incorporate regular physical activity, like walking, into your routine. C. You should avoid all physical activity to prevent strain. D. Increase your intake of vitamin K-rich foods. Answer: B. Incorporate regular physical activity, like walking, into your routine. Rationale: regular physical activity, such as walking, helps improve circulation and reduce the risk of clot formation. Fluid restriction and increased vitamin K intake are not recommended in this context. Question 17. A nurse is assessing a patient with a suspected pulmonary embolism. Which of the following is the most indicative clinical sign that the patient may have a PE? A. Bilateral leg swelling. B. Hemoptysis and sudden, sharp chest pain. C. Persistent cough with sputum production. D. Wheezing and rhonchi upon auscultation. Answer: B. Hemoptysis and sudden, sharp chest pain. Rationale: hemoptysis, and sudden, sharp chest pain are classic signs of a pulmonary embolism. While other symptoms like cough or wheezing may occur, they are not as strongly indicative of a PE. Question 18. A patient with a history of pulmonary embolism is on long-term anticoagulation therapy. The nurse should instruct the patient to avoid which of the following to minimize the risk of bleeding. A. Green leafy vegetables. B. Over-the-counter herbal supplements like ginkgo biloba. C. Engaging in light aerobic exercise. D. Drinking more than 2 liters of water per day. Answer, B. Over-the-counter herbal supplements like ginkgo biloba. Rationale: herbal supplements like ginkgo biloba can increase the risk of bleeding, especially in patients on anticoagulation therapy. Patients should consult their healthcare provider before taking any supplements. Question 19. A nurse is evaluating a patient's understanding of the dietary restrictions while on warfarin therapy after a pulmonary embolism. Which food choice made by the patient requires correction? A. Grilled chicken with steamed broccoli. B. Spinach salad with vinaigrette dressing. C. Baked salmon with quinoa. D. Greek yogurt with berries. Answer, B. Spinach salad with vinaigrette dressing. Rationale: spinach is high in vitamin K, which can interfere with the effectiveness of warfarin. Patients on warfarin should monitor their intake of vitamin K-rich foods and maintain consistent levels in their diet. Question 20. A patient with a confirmed pulmonary embolism develops sudden hypotension and cyanosis. What is the most likely cause, and what should the nurse do? A. Massive pulmonary embolism, initiate CPR. B. Hypovolemic shock, administer IV fluids rapidly. C. Cardiogenic shock, administer vasopressors. D. Anaphylactic reaction, administer epinephrine. Answer, A. Massive pulmonary embolism, initiate CPR. Rationale: sudden hypotension and cyanosis in a patient with a pulmonary embolism suggest a massive PE, which can lead to cardiovascular collapse. Immediate CPR is necessary to maintain circulation and oxygenation until more advanced interventions can be applied. Question 21. A patient is admitted with a suspected pulmonary embolism and is placed on continuous ECG monitoring. Which ECG finding is most commonly associated with a pulmonary embolism? A. Sinus bradycardia. B. Right bundle branch block. C. S1. Q3. T3. Pattern: prominent S wave in lead 1, Q wave in lead 3, and inverted T wave in lead 3. D. Atrial fibrillation. Answer: C. S1. Q3. T3. Pattern: prominent S wave in lead 1, Q wave in lead 3, and inverted T wave in lead 3. Rationale: the S1. Q3. T3. Pattern on an ECG is a classic, although not always present, finding in pulmonary embolism. It indicates acute right heart strain due to the increased pulmonary pressure from the embolism. Question 22. A patient recovering from surgery suddenly complains of shortness of breath and chest pain. The nurse suspects a pulmonary embolism. What diagnostic test is most likely to be ordered to confirm this diagnosis? A. Chest X-ray. B. Pulmonary angiography. C. Ventilation perfusion, VQ, scan. D. D-dimer test. Answer, B. Pulmonary angiography. Rationale: pulmonary angiography is considered the gold standard for diagnosing a pulmonary embolism, as it provides a direct visualization of the pulmonary vasculature. While VQ scans and D-dimer tests are also used, angiography is the definitive test. Question 23. A patient with a known pulmonary embolism is receiving oxygen therapy. Despite this, the patient's oxygen saturation remains low. What should the nurse consider as the next step? A. Increase the oxygen flow rate. B. Switch to a non-rebreather mask. C. Prepare for intubation and mechanical ventilation. D. Check the patient's blood pressure. Answer: C. Prepare for intubation and mechanical ventilation. Rationale: persistent hypoxemia despite oxygen therapy may indicate severe impairment of gas exchange due to the pulmonary embolism. Intubation and mechanical ventilation may be necessary to ensure adequate oxygenation. Question 24. A patient on long-term warfarin therapy for a previous pulmonary embolism presents with dark tarry stools. What is the nurse's most appropriate action? A. Advise the patient to increase dietary fiber. B. Check the patient's INR and contact the healthcare provider. C. Administer vitamin K as an antidote. D. Encourage the patient to drink more fluids. Answer: B. Check the patient's INR and contact the healthcare provider. Rationale: dark tarry stools indicate gastrointestinal bleeding, which can be a serious complication of warfarin therapy. The INR should be checked to assess the degree of anticoagulation, and the healthcare provider should be notified immediately. Question 25. A patient being treated for a pulmonary embolism with low molecular weight heparin, LMWH, complains of severe abdominal pain. The nurse assesses significant bruising around the injection sites. What should the nurse do next? A. Administer a higher dose of LMWH to manage the pain. B. Notify the healthcare provider and prepare to administer protamine sulfate. C. Apply ice to the bruised areas to reduce swelling. D. Instruct the patient to take an over-the-counter pain reliever. Answer: B. Notify the healthcare provider and prepare to administer protamine sulfate. Rationale: severe abdominal pain and extensive bruising can indicate internal bleeding, a potential side effect of LMWH. Protamine sulfate may be administered as an antidote, but the healthcare provider must be notified first.